Hello everyone, today we're discussing visceral diagnosis week 1. We're going to split it in between lab and lecture material, even though they slightly overlap. Okay, in lecture, he pretty much started off talking about how to structure taking a patient's history, and there are 6 components to that. The first one is the chief complaint, that is the way in which the patient describes what is ailing them. The second one is the present problem. In this case, you're going to be going over what we learned in MOPAL 2, the OPQRST, which is onset, palliative, provocative, quality, referred pain, site, and time. Next would be taking the past medical history. Is if they've been hospitalized, if they have any surgeries at all, whatever happened. Next would be family history. This is the closest relatives, the grandparents, father, mother, sister, brother. Next is social history, their work habits, their diets. You can just do this by generally asking them how their day went. And lastly, you're going to do a full systems review to check for any other systems that may be involved in what is ailing them. And at this point, you would ask if there's anything else concerning the patient. From there, he discussed the vital signs, which we'll get to when we discuss the lab portion a little bit more. The main vital signs, you're going to be taking pulse, on average, 60 to 90 beats per minute. Tachycardia would be fast heart rate, in which it would be more than 100 beats per minute, and bradycardia, which would be less than 60 beats a minute. Heart rate. Dr. Elsanjak mentioned that tachycardia can be caused by hyperthyroidism. Also, when you're taking heart rate, you're going to check for irregularities and arrhythmia. Arrhythmia happens to be the first symptom in a heart disorder. He discussed the average heart rate or not the heart rate, but the blood pressure based on how old someone could be. So a newborn, the average would be between systolic 170 and diastolic 120. It tends to narrow down as they get older. So at a year, it'd be 160 over 80. By 3 years, it's 120 over 80, and 10 or more years, the average is 110 over 70. Temperature can be taken in 3 places. Orally, which is your normal 98.6 degrees Fahrenheit. You can take it axillary under the arm, which is 1 degree less at 97.6, or rectally at 99.6, 1 degree above. We also discussed a respiratory rate. Normal respiratory rate is 10 to 20 breaths per minute. He then went on to discuss examination techniques. There are 4 examination techniques. You're looking at inspection, so you're just looking at the person for evidence on the outside. Palpatory, where you palpate different areas. Percussion, where you're trying to get sounds by banging on certain areas of their body. And auscultation, where you're listening to the stethoscope. He discussed a few common disorders. He went into alopecia, which is the sudden loss of hair. This is distinguished from male pattern baldness because it's a rapid loss of hair. It's an unknown etiology. Prognosis is 50-50 and it occurs in men and women equally. There are 3 different types. A rella, which is a small area of the head. Totalis, the entire head loses hair, or universalis, where your entire body loses hair. We went on to discuss Graves' disease, which is an endocrine issue, and also hyperthyroidism. Exophthalmos is the bulging eyes, which is the characteristic of Graves' disease. This is due to the proliferation of the fat cells behind them, and you won't see any white in the eye. He went on to talk about jaundice, which is 90% due to the liver, but it could also be due to the gallbladder. And he talked about 2 hypersecretions of the pituitary gland, and it's all based on whether or not the growth plate in the bones had closed. If it's before that, it's known as gigantism, where the person grows vertically, and if it's after the closure, it's called acromegaly, where they grow laterally. Moving on to the lab, we pretty much this week discussed how to take the vital functions. We talked about taking the pulse on the radial artery. You're going to do that for a minute, and you're going to take, for the first half of the minute, you are going to check for the rate, how many beats per second, or per minute, the rhythm, the regularity of the heart pattern, the amplitude, whether or not it's strong or weak, or the contour, the description of it. So you're going to take that for 30 seconds, and you're going to multiply it by 2, so you should have an even number. And for the last 30 seconds, you're going to take the respiratory rate and also divide that by 2. At the same time, so that it's quickly, so it moves quickly, you're going to use a thermometer to take the temperature orally. After the heart rate is done, you're going to start checking for the palpatory systole. You put the blood pressure cuff on. You want the artery line on this sphygmometer placed on the brachial artery. You're going to find this by having the flexor bicep, push in to find it, line it up, make sure that it's at least it's 2 to 4 centimeters from the cuboidal fossa. You want it tight so that you can't fit more than 2 fingers underneath. You're going to pump it up slowly while having your fingers on the radial artery until you can no longer feel it. You're going to go a little bit past that, and then you're going to slowly let the air out at about 3 millimeters of mercury per second. Once that comes back, you have now recorded the palpatory systole. From there, you're going to determine the auscultatory systole, or the regular blood pressure, and you're going to do this using the stethoscope. So you're going to go 30 millimeters of mercury above the palpatory systole, and then you're going to slowly let it out at that 3 millimeters of mercury per second. And once you hear the first heart sound, that determines systole, and once the heart sound ends, or the last heart sound you hear will be diastole. That's about all we covered this week. See you guys later.